If you or your partner have ADHD, you may be wondering, what should I treat first if I have both ADHD and, some other issue like anxiety? First of all, it's very common for people with ADHD to also struggle with something else, like depression or anxiety, or, you know, oppositional defiant disorder. Dyslexia actually is also pretty common. And then alcohol dependence or substance abuse or, other conditions like Tourette's or learning disabilities or sleep apnea. So you may be wondering, where do we even begin if especially if this is a later in life diagnosis. So knowing what to treat first is usually going to be at the discretion of your doctor or your physician. So if you have something like a history of depression in addition to ADHD, your doctor may choose to start treating them both at the same time. Maybe they give you an antidepressant for the depression and a stimulant medication for the ADHD, and maybe recommend therapy for some behavioral sort of techniques to help you to learn how to regulate your attention. But maybe you have a shorter term, more recent depression, and your doctor may say, let's just treat those ADHD symptoms first, and then maybe the depression will be lifted because maybe you've just been kind of down lately because you have so many ADHD symptoms and it's really wreaked havoc on your life. So there is some flexibility there if you or your partner are struggling with both ADHD and something else. So I think it's really important just to kind of individualize treatment and to develop a really good relationship with an expert who really specializes in ADHD as well as the other sort of issue at hand. And it's also finally important to note that there are a lot of misdiagnoses. So sometimes people may think they have ADHD, but they don't. So if you're sleep deprived or have sleep apnea, or there can be other sort of issues like if you're having a lot of distraction, there could be something biological going on. There could also be a mood disorder. Sometimes people have bipolar disorder, but that's often confused with ADHD. So especially, if someone has a lot of rage or long periods of sleep deprivation or kind of like a lot of energy or manic behavior or racing thoughts, that can look like ADHD, but sometimes that can be bipolar. So it's really important to see an expert psychiatrist who really can distinguish between the two.